Okay, so we're in our dry cupping workshop and we've been given a question or asked a question as to how much pressure is right and how do you know how much pressure to apply. So when you're applying, there's a general principle. You can say that you have strong suction. Okay, so strong suction can be seen by the amount of, let's say, pumps that you do. Okay, so we're going to maximum pump as much as we can. Okay, and that would be classed as kind of really, really strong suction. The amount of bulge can give us an indication as to how strong that suction is. However, that's not always the case, because if this tissue was very taut, so for example, if I was applying on the head here, okay, I could do maximal cups, but that isn't going to create a big tissue bulge. Why? Because the tensegrity of the tissue, or the kind of the tension within the tissue is different. So I could be, so right now I've just done a small amount of suction, and if we go a little bit further, okay, that's pretty strong now, yeah, and that would probably cause quite a bit of pain if I carried on applying that suction. So even though the amount of tissue bulge you have in the cup is an indication as to the amount of suction or the strength of the suction, it isn't definitive, because it depends on how loose that tissue is. Okay, so that's point number one. It's an important point to note. So the amount of suction you apply will tell you how strong it is. So if you apply maximum amount of suction, then it indicates that it's a strong suction. If you apply a very light amount of suction, so I'm just, let's say for example, a small little pump that I've put in, it doesn't, it's not a strong suction from that. So we have what we class as kind of strong, medium, and light suction. Now, a good way of determining the suction, rather than just looking, is having a feel of how strong that suction is. So if you have a cup where you're able to glide it nice and easily, okay, and freely, and it's not tugging on the skin too much, okay, this tells us that this suction is relatively light. This I would class as a medium suction, because I do have to put a little bit of effort to get it moving, but it's not completely loose. Whereas if I was to, let's say, use this cup now, where I'm just going to apply the slightest amount of suction, so this would be classed as weak suction. Now, this doesn't take a lot of effort to pull off. Okay, so this would be classed as weak. Okay, this is medium. Okay, I can move it around and I can pull it off, but it's not, again, it doesn't take too much effort. And then we've got strong, okay, where it's difficult to glide the cup. Okay, and when we're talking about moving cupping and gliding cupping, I generally say you should be able to maneuver the cup with one hand. Okay, so quite easily. Whereas this one, it's strong, it's not moving, so this is classed as strong suction. Now another caveat to that is that this is all subjective. Okay, so if you're communicating with your patient well, you will know if that suction is strong, medium, or light, based on their feedback. Okay, so it's not just based on your thoughts of how strong that suction looks or how many pumps you've done. This is very much based on the sensitivity of the patient. You may have someone who you apply the lightest suction and you do just some very light moving cupping, for example, and they consider that to be extremely uncomfortable, painful, sensitive. Again, we don't know where their threshold of pain is, because there could be some underlying issues or injury that's already there. So their thresholds could be very low. Or you could have someone who you're putting maximum suction and they're saying to you, could you tighten the cups up? Okay, so I hope that answers the question in terms of how do you get a feel of what the strength of the suction is and how to know how much to apply. It's really based on all of those factors and also your objectives of what you're trying to achieve with the treatment.